All right, so hey everyone, my name is Avery,
My name is Ingrid.
and we're from Queen's Health Outreach, or QHO. QHO is a student-run organization out of Queen's University in Canada, and our goal is to facilitate discussions about topics related to physical, mental, and sexual health.
We at QHO are really excited to be partnering with Service to Humanity to run 5 health-related workshops over the next 2 months. So today we're going to talk about mental health. But first, we'd like to give Ryan and Shanta, our awesome collaborators at Service to Humanity, some time to introduce themselves.
Yeah, so if you guys want to introduce yourselves, please feel free.
Good afternoon, everyone. I am Ryan Bagirat, and I am the administrator here at Service to Humanity. We are indeed happy to be on board with QHO, and let's just get on a roll and let's hope that this workshop comes out successful since it's going to be a virtual workshop. Of course, we all know that this is a very tedious time for many of us with all of the COVID and stuff. So just on an announcement on our end is that we still emphasize on everyone to continue wearing your face mask, continue to sanitize, as well as maintaining your social distancing. Let's hope for the best and let's hope the workshop from here and onward, it turns out to be something that we can all emphasize and we can also gain a lot from. So I'll hand you over to the coordinator.
Hello, good afternoon, everyone. My name is Shanta Youngkam, Coordinator of Service to Humanity. Today's Children Our Future. And I'm happy to be one that will be collaborating with QHO. And I hope that whatever input is put here, it benefits to a lot of people in the community, elders, single mothers, children, as well as university students. So I hope that you guys have a successful workshop. And I'm happy again to be part of it. And thank you, QHO, for choosing our NGO as part of your team. Thank you.
Thank you so much. All right, so before we get started, we just want to let everyone know that our discussion today is going to include topics surrounding mental health, mental illness, and stigma. We understand that these topics can be challenging or sensitive to discuss, and if you need to go on mute or even leave the meeting for a little bit to take a break, please feel free to do so. We want to create a safe space to talk about all of these things. Yeah.
Yeah, okay. And the final thing we want to mention before we get started is just to reiterate that we are a pseudo-run organization. We are not health professionals, we are not teachers, and we are not a crisis line. We're just here to facilitate discussions about health, and hopefully all of us will learn a few things along the way.
All right, so to get started, I want us all to think about how many people out of 5 people even has mental health. So in just a second, I want us all to hold up our fingers to show how many people out of 5 we think has it. So everyone, you don't have to turn your camera on if you don't want to, you're welcome to, but just like to yourself, you can, you think 2 or 5 or 1, just hold it up. And if you are holding up 5 fingers, that's right, because 5 out of 5 people has mental health because everyone has mental health. So that's why we're talking about mental health, and it's so important, especially with COVID this past year. Mental health is like really important and everybody has it. So the first thing I want to know is what we all know about mental health right now. So I'd like us all to either turn on our mics or write in the chat something that we know or think about mental health. It doesn't have to be anything too big or serious, but like it can be if you want. Just whatever you want to say is totally fine. And Ingrid and I are going to write everything down on the next slide about what we know about mental health, just to kind of get a sense of what everyone here knows or just thinks about it. So I'm gonna just exit out of presenter mode, and if anyone has anything they want to contribute just in like the next minute or so, they can feel free.
It doesn't have to be something super complicated, like literally anything that comes to your mind about mental health, anything you want to share, any little comment.
How we feel impacts our day, can be good or bad. Yeah, those are all really great ideas. Yeah, can make us feel down. All right, those are, oh yeah, awesome. Affects our relationships. Oops, I spelled that wrong. Okay. Yeah, so those are all really great ideas about how, what mental health is and like what we can kind of think about it. So I'm gonna go back onto the full presentation. Just a second, it's just loading. But yeah, so those were all really amazing ideas, and I think we've got like a good foundation to work off. So the most learning comes from sharing ideas. So if you think of anything else throughout the workshop or you just have questions, please feel free to either raise your hand or type them in the chat. And we'll also have some times where we have like open for questions. So you can also feel free to turn on your mics and talk if you want to then as well. So when it comes to mental health, we're going to start off like really simple and go from there. So if we break down the term mental health, mental refers to our brains and mind and how they work and feel, and then health refers to being free from injury, illness, and pain. So therefore, mental health is a state of well-being where we realize our own abilities, can work productively, and contribute to our communities. Mental health affects how we think and feel about ourselves and others, and how we think about and react to events, for example, like dealing with stresses like COVID. Your mental health can really impact how you deal with that. So therefore, mental health is something that everyone in the whole world has, and it's really important. If anyone has any questions right now or things that they would want to clarify, that's fine. If not, we can move on. I'll just give you guys a second, but. All right, if anyone has anything that they want to say later on, that is also fine. Feel free. Okay.
So we've arrived at our first of 6 true or falses that we've actually scattered throughout this presentation. And they're just little statements about mental health. And we'd like you guys to just type in the chat whether you think it's true or false. So the first one, true or false, mental and substance use disorders are the leading cause of disability worldwide.
All right. Shall we move on?
I think we can, yeah.
Okay.
So that's actually true. Mental and substance use disorders are the leading cause of disability worldwide, which kind of goes into what we've been reiterating is that, everybody has mental health, but even though mental disorders is something that not everybody has, it is something that occurs worldwide and is something that should be talked about and something that's worth discussing. All right, so for this next activity, I will be telling a story about someone named Sam's day and all the good and bad things that happened. Every time I say something bad, Avery will be putting an item in her backpack, and every time I say something good, she will take something out. If anyone wants to join in, I'll give you a few seconds to grab a bag, a bin, anything you can use to just store items in, take things out, and yeah. Okay, so we'll get started with Sam's story. So Sam wakes up in the morning and panics because she realizes she missed a lesson on Zoom. Her day already isn't going so well. Her mom reminds her that her lessons get posted online later in the day, so Sam manages to calm down a little bit. As she's doing her homework, she gets visibly annoyed and frustrated. She does not understand the topics, and her brother won't stop being loud beside her, and Sam just can't concentrate at all. Luckily, her brother decides to go outside to exercise, so she gets some peace and quiet again and eventually figures out the problem. The rest of the day goes smoothly until her mom gets home from work. She tells Sam that one of her friends actually tested positive for COVID and she might have to go into a hospital to self-isolate now. All right, so you might be wondering, what was the point of that? What does the backpack represent? The backpack represents Sam's mental health and how it moves along the mental health scale. The mental health scale is a fluid and dynamic thing, and events in our lives can make us range anywhere between healthily stressed to struggling to crisis. For Sam, every positive event pushed her a little closer to healthily stressed, and every bad event pushed her a little closer to crisis. While most of Sam's day was pretty typical, pretty normal, her day ended with some really bad news from her mom. When this happened, Avery put her final item in, and the bag became heavier than usual and harder to carry. And this shows we really just don't know how many things people already have in their bags, and if one thing could push us right over to struggling or crisis. With that in mind, it's important for us to remember at very different levels. So for example, while the news about Sam's friend definitely caused Sam a lot of stress, it's definitely a lot more stressful for her family to be dealing with and just to try to figure out what their situation would be moving forward.
All right, so moving on to our second true and false. So, true or false, our mental health is stable and rarely changes between good and bad. I think you might know the answer based on what Ingrid just was talking about, but nevertheless. All right, and I'll just move on. So that is false. Mental health can fall anywhere on the mental health scale due to situational, emotional, behavioral, physiological, and or cognitive factors. So it's really important to remember that. It can change.
Quickly just explain what those factors mean, and as I do, I kind of want us to just think about how each factor is related to the current COVID-19 pandemic, resonate with in terms of the different categories. So situational factors can involve our relations, can also involve our financial. Everyone's living situations have, I'm sure, greatly changed from before, and many of us are still trying to find our new way of life. Emotional factors can involve positive feelings towards yourself and your loved ones, ourselves in a confident and capable manner. And in our current period of uncertainty, being kind to ourselves or finding comfort in our loved ones can just make everything a little less scary. Behavioral factors can be good things, like, spending time with our friends, our loved ones, but it can one our mental health if we think about the scale when it starts to go towards struggling and crisis. This has been a big one in COVID-19 because with lockdowns and social isolation, that's kind of stopping us from doing a lot of the things that we used to be able to do and see a lot of the people that we want to see. Physiological factors can be related to diseases or having injuries. So this is especially relevant for anyone that has or knows somebody who tested positive for COVID and kind of just needs to plan their next steps health-wise, as we saw with Sam's friend. And finally, there are cognitive factors, which can involve having a negative or positive outlook on life. It can be very easy to start stressing over numbers and news about COVID, so it is important to focus on things that we can control in our lives and to kind of just appreciate all the positives, such as having our friends and family around.
All right, so I know that that was a lot of information, but the takeaway message is that it is perfectly valid to feel like we are struggling in any of the 5 factors, especially in the middle of a global pandemic, because everyone else is likely being affected in similar ways. Yeah.
Yeah, so I'd like us now to take the time to brainstorm a little bit more about the mental health factors. These, like I said, could be general examples, examples related to COVID, or just any little comments anybody has about one of the 5 factors. So feel free to turn on the mic or actually share my screen and we can create this on a mind map,
Yeah, hold on. I'm gonna have to.
just so we can kind of get everybody's ideas.
Okay, Ingrid, are you able to share your screen?
Let me try. Can you guys see that?
Yes.
Okay, awesome. So I actually can't see the chat right now. So Avery, if you don't mind just letting me know what everybody's saying and in the factors, that'd be amazing.
Yeah, so for emotional factors, does anyone have any ideas? So like how you feel about things. I mean, yeah, so feeling sad or happy,
All right.
a good one. Um,
Oh, there we go. Don't know why it suddenly kicked me out, but yes, feeling sad or happy, definitely.
yeah, maybe feeling stressed about COVID,
Definitely.
or
For a
maybe feeling
variety of reasons.
angry. Um, that's also totally valid right now. All right. Oh, we've got 2 for situational. So we've got not being able to see friends and family, and we've also got like being alone. That's really tough. That's a really important one. Um, Maybe in terms of cognitive, I think that's one of the harder ones to kind of wrap your mind around what it means. So it really has to do
In
with,
terms
sorry?
in terms of situational as well, there are other things that makes people it's something that we know that's a situational crisis would be poverty, and that would contribute further to emotional stress.
Yeah, I think that's a
That,
really, really good one.
mhm. It's really important that we brought that up too, because a lot of these factors, it's like they don't just exist alone. Like all of them kind of have an impact on each other. And through that, it has an impact on the individual's overall mental health. So this was definitely a very
Yes, so yes, I agree with Ingrid because we know that if somebody is suffering from poverty, which is a situational one, depending on the environment they're in, which is a physiological something, or in terms of physical, the environment they're living in, it can cause some type of stress that will even affect them to the extent of an emotional gesture, right? This can further also lead to a behavioral changes. It can affect them in terms of kids, for example, how they would cope in terms of schoolwork. Take, for example, if some kids know that they are very well poor or they're a sufferer of poverty, they'll have things like these low self-esteem and all of these things here. So each of these factors are linked one way or the other to the next.
Yeah, you're completely right about that. Like they're all so connected, which is kind of why we wanted to do this activity, was to kind of show how, a lot of things to do with your mental health have to do with lots and lots of different factors, which means it's really not something to be ashamed of if you're struggling with your mental health, because it can be affected by so many different things.
Mhm. And so many different things on different levels for everybody, because everybody has their own experiences. So like it really just fully depends on, what you're going through and your own life experiences.
Yeah, I think Ryan, you made like a really great point there, and I'm really glad you brought that up. Yeah, so maybe we can move on from that. I think we had some really amazing ideas. I will now share my screen again. Um, Okay, is that good? Can you all see that? Okay, so, oops. All right, so our next true or false is true or false. Only 5% of the world's children and adolescents have mental disorders or problems. So only 5%. What does everybody think? All right, in just a second, we will move on to the answer. That is false. It's actually 20% of the world's children and adolescents have mental disorders or problems. That's 1 in 5 of the world's children and adolescents. That's so many people. So it's kind of, it really illustrates how, once again, you know, struggling with your mental health is not something to be ashamed of. It's super, extremely common. And as we just talked about, it can be affected by tons of different factors and circumstances. So it's always important to acknowledge that, you know, it's okay if you're struggling with your mental health. It's not something that's bad about you. All right, so we're going to kind of shift gears a little bit to the topic of mental illness, which is a slightly different topic from mental health. Mental illness, also called mental disorder, can be described as a disturbance in thoughts and emotions that decreases a person's capacity to cope with the challenges of everyday life. So, you know, we face different challenges, like, for example, as Ryan was saying, with challenges related to poverty, or if you also just challenges related to COVID. And having a mental illness can make it even more difficult to cope with those challenges. So everybody has mental health, but only 1 in 5 people will develop a mental illness over their lifetime. Saying only kind of, it's not a small amount of people. 20% of people is a lot of people. And additionally, mental illness can only be diagnosed by a doctor or other medical professional, similar to how only medical professionals can diagnose serious physical illnesses like cancer. Yeah.
For this next little bit on mental illness, we'll get to quickly know a little about Bob and Corey, who are both really great people. So Bob loves talking to new people and is one of those people that makes friends really easily. Bob is funny, outgoing, works really well in team settings, such as on a sports team. And Corey loves reading, but would prefer to stay at home than play sports outside. Corey has a few close friends, but is overall a little bit shy and kind of keeps to themselves. Now, we think that Bob and Corey are both really great people, like we'd be friends with both of them fully. However, based on the descriptions, I guess who do we think is more likely to have a mental illness? We can kind of just put our answers in the chat box to turn on our mics to answer again. Just from like the descriptions alone. All right, I'm seeing both Bob and Corey in the chat. So the answer actually is, yeah, Avery just.
Yeah, I got it.
No problem. So it's actually Bob who was diagnosed with anxiety last year. So obviously in the chat, we got people who said both Bob, we had people say Bob. We also had people say Corey. But basically what this activity is trying to show is that sometimes it can be the people that we don't expect and the people that we don't guess to have a mental health that end up having it. And even when it is somebody that, you know, we kind of expected, we saw the signs, that should not change at all how we feel about them as a friend, family, or anything else. When we think of certain traits about Bob and Corey as negative or different, though, we may be showing something called stigma, which Avery will go into this concept in depth later on. But overall, it's just super important to keep in mind because, you know, we are people before we are our struggles, and people are not defined by their mental illness. So to kind of put it into perspective, let's say, you know, somebody's dad broke their leg or their arm. You know, they wouldn't suddenly think of or call this person the man with a broken leg. They would still just be their dad. You know, we wouldn't treat
this person wouldn't treat their dad any differently. So why would they treat their friend any differently for a mental illness when, you know, they've always been their friend and they've always just been this person? So definitely a very important thing to keep in mind. And yeah, that's kind of what I was going through in the last slide. Sometimes it's the people we never expect to have a mental illness that are struggling. And, you know, despite that, we just have to remember that people are not defined by their mental illness. And it is totally normal to go through struggles and to not always be the best in terms of your mental health and to not always be completely thriving when you have a mental illness.
All right, so moving on to our next true and false. So in the Bob and Corey example, we saw something called stigma. So we're going to start with this true or false question. So stigma and discrimination against patients and families prevent people from seeking mental health care. So, you know, do people not seek mental health care because they're concerned about stigma, even if they maybe don't have the terminology of stigma? So this is true. Stigma and discrimination are huge reasons why people don't seek mental health care. And this is a really big problem. So we're going to kind of delve into what stigma is so we can kind of unpack that a little bit.
Yeah, so as you can see, stigma is a really important concept to discuss. Stigma is basically a mark or sign of disgrace or discredit associated with a particular circumstance, quality, or person. In other words, stigma is a negative idea someone could form about another person because certain characteristics about them makes them different from other members of society or makes them seem different from other people in society. So when people associate certain negative traits to an individual with a mental illness, they are assigning this person a stigma. And stigma can result in the exclusion of people with mental health problems from activities that are open to other people, such as getting a job, finding a safe space to live, participating in social activities, or even just having a relationship. And even though a person may have a mental disorder, they are just like any of us here in this call. You know, they probably have their own likes and dislikes and their way to just go about their own lives in similar or different ways than we do.
So stigma is clearly a bad thing. So how can we stop it? Well, a great way to kind of get started with stopping stigma is by remembering the acronym WALS. So we're just going to kind of get into the acronym, and then in the chat, as kind of we go through each letter, if anyone has an idea of what each thing could maybe look like, and I'll give an example for W, you can just drop it in the chat and we can have like a little bit of a discussion. Ingrid, if you don't mind watching the chat, that would be really great. So W stands for watch your language. So does anyone kind of okay, wait, I'll give an example. So one thing you could do to watch your language about stigma related to mental illness is when someone has a mental illness, you could avoid using words like crazy or stupid or whatever, because those terms have a really negative connotation and it's not actually what's going on with the person. So avoiding those words could be really helpful.
In the chat, we also have other words like mad or psycho. It's the same idea where those words have really negative tones attached to them, and so we never really want to call another person that.
Yeah, that's a really great point. All right, so moving on to A. A stands for ask questions. So does anyone have maybe some examples of like what kind of questions you could ask? Yeah, so I'm actually able to see the chat. So I can see ask them what you can do to help or ask them how they are, which is really great. I think those are both amazing examples. So the main idea is just not to be afraid to ask people about their experiences and to keep an open mind. All right, so for L, it's learn more. So maybe what could we learn more about to try to like reduce the stigma surrounding mental illness? If anyone has ideas. Okay, so I'm seeing doing your own research about mental. mental illness, that's really like a really great point. There's lots and lots of resources. This workshop is one of them, but there's plenty of resources that you can seek to learn more. So you want to learn more about mental health, mental illness, and stigma. And coming to this workshop is a really great first step. And even kind of going back to asking questions is another great way to learn more about mental illness and mental health. All right, the second L is listen to experiences. So I'm not sure if we can really give examples of this, but basically you want to learn about people's experience with their mental health, and it's more likely than not that you'll actually have more in common than less. So even if you don't have a mental illness and your friend does, if you kind of each talk about your day, it's really a lot more likely that you guys are going to have way more in common than not in common. And then the S stands for speak out. So if you hear someone assigning stigma, so maybe like we were saying with the language, they're saying that someone with a mental illness is crazy or stupid or psycho, say something about it and have a conversation about why that's wrong and how they can do better, because they probably just don't understand how what they're doing can be harmful or hurtful. So, speaking out and kind of trying to help people learn is a really great way to help address stigma as well.
Yeah, and just overall standing up for a friend or family member just to show that you're in their corner, you're there to love and support them, despite any of their struggles that they're currently going through.
Yeah.
So I want to quickly cover stress for a second because it's something that's come up a couple of times today in our discussions, especially when we were talking about COVID and just all the stressors related to that. So stress is the body's way of responding to any demands, whether good or bad. When something stressful happens, our bodies respond by releasing chemicals into the blood that give us more energy and strength. So stress can actually be a good thing if we are in physical danger. So for example, feeling stressed when we're in the woods and we see a bear can help us respond accordingly to protect ourselves. But obviously, stress is more commonly used in a negative context, which happens when it is all emotional with no place for the extra energy to go to. And that can be very hard for the individuals for us to deal with. Is once again feeling stressed during COVID, one way or another, whether that be financial stress, family situations, fear of the future and of the unknown, and like we saw, so much more that really just depends on our individual circumstances, our environment, and our experiences. So our next true or false is mental disorders do not affect your risk for other diseases or injuries. Right, I'm seeing both false and true in the chat.
All right, let's see what it is.
So that was actually false. Mental disorders are important risk factors for other diseases as well as unintentional or intentional injury.
All right, so in order to reduce our risk for disease and injury and other kind of negative things associated with having, struggling with your mental health, it's important that we practice self-care to feel good about our bodies, mind, and health. So the WHO, which is the World Health Organization, defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with and without the support of a healthcare provider. So the core principles of self-care, according to the WHO, involve self-reliance, which means using your own efforts and abilities. So, you don't have to rely on other people. It's okay to need to rely on other people, but it can feel really good to be able to do things for yourself, even if they're just small things. Empowerment, so feeling authority or power to do something. So maybe if you're in a situation that you don't like, feeling like you have the authority to get yourself out of that situation. Like even if it's just you are somewhere and you want to go home, it can be as simple as that. Autonomy, meaning being in charge of yourself. So, nobody's bossing you around, nobody's making you do anything. We yeah. Personal responsibility. So this is like owning our own decisions. So, we can make decisions for ourselves. Self-efficacy is believing in ourselves. So we believe in our abilities to do things, and aspects of the greater community, such as community participation and involvement. So, us feeling like we're involved in our community can really be helpful. So self-care is especially important during COVID, and you might have to find different ways to do self-care, but that's okay, and we should all still try to make it a priority. So, to kind of help us all figure that out, because it can be challenging, we wanted to make a self-care plan, just a really simple one. So we've organized self-care into 5 pretty easy categories. I'm going to explain what each category means, and then maybe if anybody wants, we can get out like a piece of paper and a pen, and we can just all write down maybe 1 or 2 things from each category that we can do to practice self-care. And then Ingrid and I will share our self-care plan that we made. And yeah, it can hopefully help you out. And they can be really simple things. So for emotional self-care, this is something we can do to regulate our emotions and have positive emotions. So anything that makes us kind of feel good. Practical self-care is something that can help the logistical/practical aspects of our lives. So just kind of helping make going about day-to-day life easier. Physical self-care is doing something to take care of our physical body. So in whatever capacity we're capable of doing that, it's really great to take care of our physical body, because when you feel physically good, it helps you feel mentally good. Spiritual self-care. So this can be to help you feel connected in any way that's meaningful to you. So whether it be a religious affiliation, or even just feeling like connected to nature or your community or anything, just, something to kind of feel connected is really great. And then in terms of mental self-care, this is kind of similar to emotional, but it's just something to keep our minds relaxed and positive. So I guess we can give anyone a second if they just if we all just want to drop ideas in the chat, or if we just want to take a second to ourselves to just maybe write down a few things in each category. Please feel welcome to do so, and we'll just give maybe like a minute to do that. And then, yeah, so I'm seeing in the chat, physical could be like going for a walk. That's a really, really great example. I think that actually might be one of our examples. Spiritual is, I'm seeing meditate. Yeah, meditation can be really great. Listening to music. For emotional, yeah, I know listening to music can really get you into whatever emotional headspace you want to be getting into. Yeah, those are all really great. Okay, so we're gonna move on, and Ingrid is gonna go over the self-care plan that we made. And yeah, we can just get a few more examples of things we can do to take care of ourselves, even if they're small.
Yeah, for sure. And obviously, the self care plan, it's okay if you can't think of anything on the spot right now. This is meant as something for us to all use in the future to just develop a self care plan in any situation. So, I'm just going to quickly go over the one that we made. So, for emotional, that's my timer. So for emotional, we can do something to help you regulate and have positive emotions. And for us, that could be writing in a journal. Sometimes it helps to just get all of our emotions out on paper and kind of just verbalize it and just validate what we're feeling. For practical, we put something that it can help you just organize the logistic or practical parts of your life. So making a weekly plan. I know I personally love making to-do lists just so I can like cross off something whenever I know like I've completed it, just so it helps me feel a little bit more accomplished. For physical, somebody mentioned in the chat going for a walk, and that's also what we put, just going for a 30-minute day, getting some fresh air can really help us to just clear our heads and just lift our moods even a little bit. For spiritual, we put practicing mindfulness, and that's kind of like very, very general. There's a lot of ways in which you can practice mindfulness, whether that be meditating or just taking a moment to take deep breaths, just anything to kind of help us ground ourselves and to just feel a little bit more stable. So finally, for mental, something to keep our mind relaxed and positive, and that would be to take time for leisure. So to set time aside for our hobbies, whether that be hanging out with friends, maybe it's something more skill related, like playing a sport, and basically just taking that time to do things that make us feel happy and make us feel positive emotions in general. So for our final true and false, the statement is globally, there is a huge inequity in the distribution of resources for mental health. I'm seeing true in the chat. All right, so that's true. While a number of countries definitely provide hotlines and other sorts of crisis supports, there is a huge inequity in the distribution of skilled human resources due to a number of factors. So when I say skilled human resources, I mean, healthcare professionals, psychiatrists, individuals like that are kind of equipped to help people deal with their mental health and mental illness in, a health setting.
All right, so we've decided to put at the end of our little workshop today just some really great resources in Guyana. So please take the time to copy them down if you would like. And while you're doing that, we are open to any final questions anyone may have, if anyone wants to discuss anything. But if nobody has questions, we also just have some frequently asked questions from previous years when QHO actually had the opportunity to visit Guyana. So, we'll give everybody a second to see if they would like to participate, but if not, that's also okay. We'll just get into the frequently asked questions.
We also have a questions box on our Facebook page if you kind of don't want to drop a question right now, or if you think of something later on, definitely feel free to drop that in and we'll cover it in one of our social media posts or videos or a future workshop.
Yeah. Ingrid, do you have the frequently asked questions up? Because I can't pull them up. I don't have them.
I can pull them up right now. Just give me a second. It's in the QHO drive, I believe.
Yeah, I think
So, just a comment. I think this workshop was well covered by the two of you. So on my end, I don't have any questions at the moment.
That's great to
hey,
hear. We were definitely.
Oh, hi, guys.
yes.
Let me acknowledge the presence of Rahaman here in the call, Rahaman Baltran. He is the other teacher who I told you guys about. He is lecturing aside of me along the online forum at the moment. So welcome.
Great. Welcome. Thank you for joining.
I think
Yes, like I said, it's been a busy day because of the holiday and all of the things. So we didn't have the turnout at the moment. I checked and I said everybody must be busy.
Yeah, that's okay. That's okay. I think it went well either way, and it's recorded. So if anyone ever wants to access it later, that is totally fine. I think we're having a little bit of trouble finding the frequently asked questions, so we might just have to save that for our next workshop. But I think we might just stop the recording here if that's okay.
what I suggest we can also do is that we can give them the theme for the next workshop, and probably they can start like look up on it ahead of time. So at least they can come to us with at least some kind of question or anything that they want to clarify and stuff while the workshop will be going on.
Yeah, sure. I think we can collaborate about that in our group chat and figure out how we want that to work. I will stop the recording now.